Welcome all of you. So today's workshop is about heavy metal and speech delay. So why did we choose this topic for today? Because many of you showed an interest about knowing about speech delay, because it's very common when a child is on the spectrum that there is speech delay in the child, and many times parents think, okay, it's because of um, the child will talk, let's wait 6 months, 1 year, another 1 year goes, you think the child will talk, but then that does not happen. In many cases the child was talking, and then after he crossed 1.8 years or 2 years, the child stopped talking. And some of course regress later, but then, so what happened around that time? And most of you, as you just reported now, many of you do not have any clue what could have happened, right? What could have led to um, the delay or the brain damage. So today's workshop is all about understanding heavy metals, where they can come from, what kind of damage they can do in a child's body, why are they doing the damage, and then what are the possibilities of recovery, and how can we do that. So we'll talk about all of this today. Um, and of course, many of you would be surprised to know that, okay, how can aluminum come in the body, or how can cadmium or lead come in the body? Very recently, there was also in the newspapers, there was a study also done at AIMS, and we were very, very happy to see that being done, because we in our practice see it so commonly that heavy metals are high in a child when they are on the spectrum. And it's good to see that it was also kind of, it's being tested in a premier institution in India, so that's good to know. And so we'll talk all about that. And for that, I have with me today Dr. AshwanI GARG, co-founder of Functional Medicine Clinic. Many of you probably may have spoken to him, may have chatted with him. So we have him with us today, and we'll now go deeper into this topic. So, Dr. AshwanI, over to you.
Thank you so much, Dr. Ruhi, and good evening to all. Thank you so much for allowing us time and giving your attention. Now, just like what Dr. Ruhi has mentioned, okay, there must be a reason. And it's a multifactorial. It's not just one reason, of course. But the bottom line is, if child is not doing okay, whether we call it global delay, whether we call it speech delay, whether we call it autism, whether we call it apraxia, based on the kind of manifestation, kind of outcome, we can name it differently, right? But at the end of the day, we still has to see what is wrong in the body or what is causing the damage. But baseline, if body is not healthy and brain is not healthy, consequently, depending on the problem in the body and the brain, there could be speech delay, there could be comprehension delay, there could be sensitivities, sensory issues, there could be aggressiveness. All of these are stemming from the poor biology that child is having. But the interesting part is many of these cases are regressed cases. 80 to 85% at least, we talk to a lot of parents all the time. And all the time parents could, my child was developing okay, things were okay, we never noticed anything. And all of a sudden, some event happened and our child regressed and lost the words, lost the comprehension, started having certain behaviors, things like that. So that means some event, some say screen delay, some say post-vaccination, some say after antibiotic, some says they have a trauma because maybe parent was on a different country for a different job. Could be multiple, not just one trigger. Or COVID infection, certainly infection is a major player. After child has developed a febrile seizure, then also regression happened. Some trigger led to the body becoming unhealthy, brain becoming unhealthy, thereby damage, thereby regression, thereby loss. Thereby growth is not as good as it should be in terms of skills. So if we have to create a possibility that we should be able to help our children, help develop their abilities, help develop their making them close to normal or better than normal, ultimately we have to make the body and brain healthy. That is the bottom line. This biology, this physiology has to get better. This is where the thing is. Okay. So we have to be focused around that only. And as we do that, and you will realize that things are getting better. So if we look at the presentation, now it's not just one reason, it's always a multifactorial. Okay. Large amount of these children, they have a poor immune function. Many of them, or large amount of them, again have a poor digestive issues. Like I said, after vaccination, after certain drugs, or if mother had been exposed to certain problems, like mother has some autoimmunity, or she has been on drugs, or during pregnancy things don't go well. Whatever it could have been, ultimately there is some level of insult on the body and the brain. Okay, leading to different problems in their system. The metabolic function is compromised, child's metabolism, their motor function is compromised, the immune function is compromised, the sensory dysfunction is there, GI impairment, hormonal function. And all of these things we put together, label differently, depending on how many problems. If too many problems, we call it ASD. If too many problems, we call it autism spectrum disorder. If few problems are there, we name it autism, we name it speech delay, we apraxia, this, that. But this is being caused by something, right? Something has led to the damage on the body and the brain. And one of the major driver of this damage could be heavy metals in their body. Now, these heavy metals can come from the parent, can come from the food, can come from the vaccination, can come from the environment, not just one. And unfortunately, the mechanisms of detoxification in these children to eliminate what has come into the body is not so great. Maybe that is their genetic weakness. They are not able to clear these toxins. Not that because genetically they should get the problem. Genetically, they're not able to clear as many toxins others would have been able to clear. Consequence, these toxins start piling up. Consequences, piling up of the toxins will start doing a damage to the immune system and the brain health and the neurons and things like that, and the regression. It's again multifactorial. I'm just picking up one point. Okay. So if we at least work on this path also, we remove these problems from the body, make the biology better, help repair what is damaged, then the child can start picking up the skill again. Right? Now, where are they coming from? Let's say when we test, the load is quite high, and problem is generally in corresponding to the amount of the problem, toxins in the body. Severe cases of the autism or delay on speech, things like that, they have a higher amount of toxins in the body. Unluckily, so far, most of the pediatrician will rub it off. Oh, there's no such thing. Don't worry. There's no. But at least, luckily, the premier institute in India, one of the doctor has been studying this part, and recently it has come to one newspaper. I mean, you can also Google and search and find out. I don't remember the name of the doctor, but recently, I mean, just a few month back or something. That means even a conventional system has started looking towards it. When will they conclude? When will they start treating it? It'll take some time. But at least they start looking into, which is a good sign, very, very good sign for all of us. Okay. So lead can come from petrol, paint, batteries, water supply pipes. Mercury can come from uh, certain vaccines. Again, fish is another big thing, or sometimes, some mercury fillings, etc. Cadmium can come from the, see, either child is exposed directly, indirectly, things will come. Cadmium can come from metal platings, okay? Tires. Arsenic can come from pesticides, huge problem. Aluminium can come from cookwares, aluminium foils, antacids, and vaccines, and all that. You see, a few times mentioned that sometimes regression after a vaccine, and maybe there's a damage to the immune system. There could also be a overload of the toxins, which start its own process. But we know that regression has happened. You as a parent, your child was doing okay, some regression happened. Why would child just like that go into regression? Right? If just a pure genetic problem it is, then from the birth itself, child should be just having the problem. Of course, there could be other reasons also. Not that only, genetics is causing the birth related problems. There could be other reasons also. But regression is just obvious. Some damage, some insult has happened to the body. And the good part is, if we understand that part and do something about it, we can undo it to a good extent. Right? So heavy metals will do a lot of destruction to the cells. They can damage the arteries, they can trigger autoimmune response, they can damage neurons also. They can damage mitochondria also. You see, one toxin, multiple damages, just like I mentioned in the beginning, it's a multi-system problem. Their hormones are disrupted, the gut is bad, the brain is bad, the liver is congested. You see multiple child, six tiny child body with so many systemic issues. Just because a child is labeled with one problem, which is called autism or ASD, we think everything is just behavior. But this behavior must be stemming from some problem, right? How can just a child, we haven't taught how to be aggressive, we haven't taught them how to be hitting somebody, we haven't taught them how to bite somebody. Why would we do that out of nowhere? Something is not right in their body. And if we have to fix that, we have to fix their body. That is the bottom line. Otherwise, no, we are not getting. So now we concentrate, if we look at the speech, speech is a function of the brain itself. You ask me a question, I will receive your question through my sensory inputs and I process it. My sensory processing unit will process, and in microseconds, my brain will use my muscles and tongue and produce a sound. But if my brain is not healthy, my speech centers has been affected, their metabolism in the speech center is not so great, or some damage has happened, disruption of the neural connections has happened, damage of the brain cells has happened. This will lead to cognitive impairment, brain development, reduced plasticity, reduced synaptic function, increased degeneration of the brain, thereby the lack of the skills, lack of this comprehension, lack of the speech. So if we have to think about in a simple way, something toxic has gone in the body that has done some level of damage, that has led to the toxicity, that has led to the loss in the skills because of these processes. Okay, so mercury, we know for a fact it's a bad stuff, but it is neurotoxic, and symptoms of mercury poison can mimic like autism. I mentioned these children have a lower ability to excrete. Not that they are genetically prone to get autism, but they genetically have a weaker ability to excrete these toxins. They built on the stores and the damage happens, and this metals can stop and prevent lot of biochemical reactions, enzymatic reactions. It depletes the glutathione. A lot of damage on the body. Oxidative stress, a lot of oxidation happening in the body, which leads to reactive oxygen species, leading to cellular damage, again inflammation, again mitochondria. Eventually, brain is not healthy. You see, brain needs a lot of energy for its work, its repair, its regeneration. If the amount of energy production in the brain is compromised, then the ability of the brain will also be compromised. It's very simple, right? So mitochondria having a damage lead to impaired energy production, increased oxidative stress, ATP production is reduced. Thereby, overall cellular production function is not up to the mark. Thereby, abilities are not great. We have to work on that. Impaired neurotransmission. Whatever the information has to be transported from one side of the brain to another side or to muscles and hypotonia and all. That also can be because of that. Right? So this is something going wrong. We have to understand what is going wrong and we have to take some steps to fix it. Okay, otherwise we are lost. We just get one name to the problem and we don't know how to come out of it. Right? So inflammation of the brain is a major problem. There's a lot of autoimmunity of the brain in these children. Immune system has become dysregulated, affecting the brain cells and damage is happening. We need to figure out what are the triggers of that inflammation, autoimmunity. We have to fix that. Okay. Eventually, all that will lead to epigenetic factors also, thereby gene expression, cellular differentiation, eventually neurodevelopment disorders. You see, every child, as a parent, for your child is 2.5 when the diagnosis is made. Slowly, gradually, there's from mild to moderate to severe, it happens. It's a progressive condition also. That means if it has happened, it can go increase also. But if we do something about it, it can get better also. So we can reverse the epigenetic change by doing certain things of improving the environment within the body or using certain things to trigger epigenetic changes. Okay. So mercury impairs neurodevelopment. Lead impairs cognitive development. Arsenic can do a mitochondrial damage. Cadmium can do a synaptic disruption. Okay. Aluminium can also do one. So you see, some of these things we can test, and we do certainly. As then this whole combination of things will lead to language delay, speech deficit, mental retardation, which is called global delay, basically. Okay. And eventually, when your brain is not so great, your hormones are not so great, you start withdrawing from the society, you don't make so friends. Even that can happen to us also. Like the moment you don't feel confident speaking to somebody, you stay back. Okay, so health is important, brain health is important for me to be socially active to make friends. Of course, hormones is another part of the equation. And these all other issues happening in the body, certain infections in the body, eventually will lead to poor concentration, poor coordination, unusual behaviors, which somebody has mentioned, biting, hitting, things like that. Okay, so this is one of the tests I'm showing. Barium is high, aluminum is high, cadmium is high, lead is high. And when you do that testing and over a period of time, you understand this in the beginning, it was a problem. As it gets better in the body, the child is also getting better. Right? This is constant damage. You remove it, body will be allowed to do some repair. It's a growing child. Repair is a natural process. Growth is a natural process. You just has to remove the hindrance. That itself becomes a big boon. Okay. So how do you take it out of the body? First thing, you have to nourish the body. So that body has enough nourishment and oxidants to take it out through skin, through kidney, through intestines. Then second level, we can use remineralization. Some minerals are missing in the body. We fit in those minerals so that As minerals go in, they can knock off these heavy metals. Next level, we can do weak chelators, glutathione, lipoic acid, cysteine, phospholipids, bile salts, binders, zeolite, humic acid, fulvic acid, charcoal chlorella. This is a great in itself. Some people, some kids, we do the basics and do these kind of supplements based on the need, based on the test, what is missing, what is not missing. And you see there's a progress. But in some cases, like I mentioned, some children are more prone to accumulate and less ability to eliminate. Probably then we have to go some little more higher, something called chelation. Then you have DMSA, DMPS, EDTA, things like that, which is called chelators. But we have to do what we have to do. Step by step, we do certain things and see the child responding. We keep testing them. If basics are working, we do the basic. If basics are not able to remove what should be removed, then next step ahead, next step ahead. But we have to remove what is toxic. You cannot run away. You have to do what you have to do. So, hope that gives you some level of perspective that something is wrong in the body, which is triggering a problem, which is leading to regression, which is leading to some damage. And until we undo, we cannot create the possibility of recovery. But we undo, we create a possibility of recovery, and this recovery can be close to or normal or beyond that also. Okay, because body as a child is young, the body is anyways going to grow. The brain is anyway, that means a lot of repair regeneration is anyways happening. It just has to put an effort to remove what is a hindrance and add what body needs. But sometimes some level of improvement will come, and you can do more improvement by pushing some more tools in the body, like regenerative medicine tools like peptides and stem cells and exosomes, things like that. Ultimately, we have to use body's own ability to push for repair regeneration. We can support the body, but we have enough tools today. Science has enough tools. They are not a common practice because it's a lot complicated than a 2-minute prescription. So it needs a lot of effort to understand the nuances, to understand what to be done. Then it has to be done over a period of time and based on the sort of how the child is progressing and doing things like that. Okay. Thank you. Dr. Ruhi, over to you.
Yes. Thank you. So thank you for summarizing a complex topic like heavy metal into something very simple. So we received couple of questions from parents, and of course we will also open for live Q&A. I'll take some questions which we already received. Um, how does heavy metal affect gut health? Because of course we see in children there are heavy metals and the gut health is messed up.
So when we say gut health is messed up, we have to understand what's happening. Majority of children, they have poor motility. Now, your motility is kind of a peristaltic movement, a regular rhythm produced by the nervous system, enteric nervous system in the intestines. So if these toxins are toxic to the brain, they can be toxic to the nervous system within the intestine. Thereby, peristalsis can become weak. These toxins can kill your immune system. And when your immune system is killed, you grow more infections. And these children has loads of infections. Infection can slow down motility. Infection can cause a lot of gas, bloating, poor stool formation, smelly stool formation, thereby symptoms. These toxins can affect the enzymes in the body. Thereby, biochemical processes are altered, thereby poor digestion, thereby undigested stool in the food. So you see, there are multiple ways you can look at it.
Yeah, and many times it's not necessary that directly the heavy metals is just impacting the brain. So there are different ways by which the heavy metal is affecting other parts of the body, which is impacting the behavior of the child. All right, moving on to the next question. I think we already spoke about it. How can I remove heavy metals? So we spoke about couple of options. And then how do I test for it? So for
Right. So you see, okay, go on, go on. Yes.
Okay, so for heavy metal testing, so one is that you test in the blood. That shows you more of recent exposure to the heavy metals, and it can also reflect what is spilling after the deposits in the tissue. And then you should also test in the tissue, and that's where you can we do a hair sample analysis to see the heavy metals, the minerals, and their ratio. So these are two ways how we do it in our practice. Mm, all right, I think let's open for the questions here. I think many of the questions we already covered in our presentation, so I'll not repeat them. Okay, I will allow. There was a lady who had, I think she hasn't raised her hand. Um, Swapnil Adhikari, are you there?
Yes, ma'am.
Yeah, you can unmute yourself. You had asked your question.
Yeah. My son, he's turning 11 this month, coming month. So recently, he's diagnosed autism. And it's been 2 months. He has been very violent, aggressive, and he's attacking us from behind. Like his behavior and tantrums are unbearable nowadays. It, and then he's urinating like every second. He's on diaper. It's been also 2 months that he's on diaper. Before he was diaper free. Since two three uh, since two since 2 3 months he was diaper free.
Right,
So
right. So
just want to know what's the cause for
yeah,
this.
yeah, yeah. So like I mentioned, as the problem in the body will increase,
Mhm.
the manifestation increase, and your child has become 11 and disease is increasing, the manifestation is increasing. Now, one of the key problem is an infection. Out of the infection, yeast and fungal infection is a major problem. These infections will produce something called oxalates. Oxalates will keep depositing. Eventually, these are sharp crystalline particles. They will do irritation of the urinary bladder, like a situation like UTI. But urinary bladder is irritated. When urinary bladder is punctured with these oxalates and irritated with these oxalates, then it cannot hold on to urine that it should. Let's say a normal urinary bladder can hold up to half a liter of urine. But in this case, because it's irritated, little urine is formed and child want to rush because it cannot hold it, start contracting. Okay, so it is not a behavior problem. It is a problem caused by infection leading to oxalates, leading to urinary bladder irritation. And because nobody connects the dots, nobody will even understand this.
Yeah, we
If
put
you
him
go
on
to a,
brain medication. One psychiatrist, he gave the double dose of minoxin 25. And after that, he's on that medicine, his behavior has increased again.
right, so we have to understand if I have a pain and there's
Mhm.
a reason of the pain and you keep doing something else only, how will I react?
Yeah,
Hmm? So child is in pain
yeah.
and we want to give some drugs to suppress somehow, make it work. It's not happening. You have to solve the problem. And by
Okay.
this time, the problem has increased to a greater effect.
Mm-hmm.
A lot of effort has to go into before slowly, little by little, little by little, we have to reduce the problem. Now, violent behavior is also a consequence of the problem only. It's not, see, why would a child be violent? Why would a child be aggressive? Why would a child be hit? When they see, we look at the humans, okay? When somebody in peace, somebody is happy, somebody is content, they are in just their own life. When somebody is in pain, somebody has deep seated problems, then you do nasty things in the world. human nature, right?
Yes.
If we bring some level of comfort in their biology, make their body healthy, they will be just like a child, happy, doing things they should be doing. But unfortunately, we don't look at the problem. And parents, every parent tries their level best, but because of lack of the right support and guidance, these problems keep increasing. And this process itself is not easy. What I am saying, I'm trying to define the problem, but when it comes to solving the problem, it's a lot of effort. It's a lot of effort. But then with that effort, we can create a chance that
So if we want to go through gut health, are we going to control on his food?
yeah, yeah,
You have to make changes in his food.
yeah.
Okay.
Food,
So I will
lifestyle.
be given the guidance, right?
Yes,
If I
yes.
go through the test and all.
Yeah, yeah. It's a food, it's a lifestyle, it's infections, it's probiotics, it's nutrition, it's oxalate removal, it's alkalinity of the blood, it's improving hormones,
Mhm.
improving immune system, then eventually improving the brain.
Okay.
Because brain is the downstream. वो सब बाद में है. पहले बॉडी को ठीक करेंगे, फिर कहीं ब्रेन को चांस बनेगा ठीक होने का.
Okay.
Okay. We'll move on to the next one. Gagandeep, you can unmute yourself.
Yeah. Hi, Dr. Ashwani. Actually, I have one question. Like, I enrolled with you guys this just 1 2 weeks back. So yeah, his treatment is going up, but I just have one question about the heavy metal thing. Like, I assume that my son's problem started with the vaccine. He was at 2 with MMR when we gave him. So if it is due to the heavy metals only, so if we work on his detoxification through, so later on, I mean, I understood that we are gonna give him supplements for the other things. So like it's been 3 years now, he's 5. So I mean, just that metal would have ruined with his whole body till now. I mean, is other than that heavy metals, is his whole body already impacted with that thing? I mean, what, like we are giving supplements for completing other things, other minerals in his body also. So my one question is that, another question is that once we work on detoxification and if it works, so will his body generate the way to fight with these metals later, or this thing will go on like throughout his body will be weak to handle these metals later also?
So Gagandeep, let us understand, I am only speaking one aspect of the problem.
Mm-hmm.
I'm not saying this is the only problem.
Yeah.
In the vaccine, there is heavy metal.
Hmm.
It's a antigen of the virus or the bacteria or things like that.
Mm-hmm.
Vaccine is, is quite a thing. Okay. We have
Yeah.
to detox the antigen. We have to detox the unwanted things in the vaccine. Then we have to stabilize the immune system, which has been destabilized the vaccine.
Yeah, it's already, yes.
Right. So
Okay.
it's not just and then one time it's like you have an engine. Even one small particle in the engine which is unwanted will stop the car. Okay.
Right.
But then the car is running, something gone in the engine is stopped, sudden brake happened, tire busted, so many things happen as a consequence.
Mm-hmm.
But to bring it back, the car function, we have to fix everything, remove what is there. But in this case, there are
Yeah,
multiple insults.
got it.
uh, Now once the major level of toxins are removed, then body can do whatever best it can do to remove. See, it's like when there's a the drainage pipe, it's loaded, then
Hmm.
nothing is moving out. But when you remove some of it, then it starts moving until unless you block it again.
Okay. So do they generate the immunity for these metals later on, or
There's
it
no
has to
immunity.
be taken
Okay,
here always?
no, please understand that everybody of us has different genetics to remove the detox, to do the detoxification.
Yeah.
Somebody might be doing 100% detoxification. Some
Hmm.
might be working at 80%. Some might be working 60%. Some might still be working at 20%. A child working at 20%, will have the highest chance of getting into a problem. That means we have to reduce the load in the body so that they don't get into a problem.
Okay. Yeah.
Not that I can make 20% work 40%. That genetics we cannot change. But we
Right.
remove and clear the road so that even if it's a narrow road, it still functions. It still works until we again clog it.
Yeah, we're trying our best. Yeah, thank you. And just one last thing, you mentioned chelation at the last. What is that actually? Is that some
Yeah.
separate treatment then after that we do?
So, like I mentioned, you have to go things at stepwise manner.
Okay. Yeah,
You
we'll
do,
get it. Yeah.
you do nutrition, you do remineralization, you see that these things are coming out. If basic works, fantastic. Doesn't work, next level, certain weak chelators like glutathione, lipoic, things like that. Then we test again after 3 months and we see how the progress, how the numbers are changing. If numbers are changing, fantastic. But it still doesn't, I have to bring a heavy duty process, which is chelation.
Okay. Okay. Yeah. Thank you so much. Thank you.
With that, I think one of the other question also got answered, which was asked in the chat. Can a genetic issue also be cured through eliminating heavy metals? So, Pratna, I hope your question is addressed. So, there may be a genetic challenge, but then if you're still loading the body with heavy metals, that will pose additional challenge to whatever defect is already there. So we have to remove all the epigenetic triggers that the body is exposed to. All right. Yash, you can go next.
Yeah, hi, good evening. Can you hear me?
Yes, yeah.
Yeah, thanks for the opportunity. Quick one. Um, can gut repair and heavy metal toxicity repair can go in parallel, or it has to be one first and the other next?
See, theoretically, they say do one after the other, things like that. But actually, reality, you have to do all things together. You go slow
Okay.
as much as body can handle, but it has to go parallelly.
Yeah. And the other question was in the slideshows. I mean, we talk about heavy metal toxicity, right? So most of the slides talk about damage to the brain, like neurotransmitters damage. So are there other parts of the, because you talked about fixing the body, so are there other parts of the body where these heavy metal toxins, can seep in, like tissue or organs?
Yeah. Heavy metal can affect your hormones, can affect your liver function, can affect your thyroid function, can affect your immune system, gut function, certainly. So it is almost affecting all systems, but because we're connecting more to the speech, we are talking about the brain.
Right, right. So basically, if the body's ability to detoxify itself can be improved. So no matter where the toxins are, they will be eliminated. Right?
Yeah.
Yep. Thanks, fine topic.
Okay. All right. Yes. Mr. Alex, you can unmute yourself and ask.
Yeah. Can you hear me clearly?
Yes. Yeah.
Okay. I wanted to know about this. My grandson has got this leucine, metabolic leucine, which is 1.23 instead of the minimum being 48. So how does this? I don't know whether it's a heavy metal or it's other thing, but how does it react in the sense
Leucine is
to?
amino acid, sir. Is it low, right? You saying it is low?
Yeah, at 1.23, and the minimum is supposed to be 48 to 324.
Right. It's a one of the amino acid, which is means maybe digestion is poor and proteins are low, thereby amino acids are low.
Pardon?
It's a one of the amino acid. Leucine is a amino acid.
Okay. Does it affect speech delay and also his bursts of anger, etc.?
You see, amino acids are the proteins are the structural raw material body needs for repair, growth, regeneration. Now, if amino acids are low, it can certainly impact in a bad way.
How do I rectify this?
Now, see, either the food doesn't have it or digestion is compromised.
Okay. I have got the report, but I have not got how to go about rectifying it. That's what. So,
I
okay, will
think,
you be able to?
yes, sir, I think your child is under our treatment, right? And the reports came recently.
Yeah.
Yes. So we will be, the assigned doctor will be doing the analysis, and then the treatment plan will be shared with you on what to be done.
Okay.
Yes. And you will be explained then what is
Okay.
there, what is the finding in the report, and what needs to be done.
Okay. Thank you very much. That's all I have. Thank you, doctor. Both of
Thank
you.
you.
Uh, Abhishek Tiwari, you can go next. Are you there, Abhishek? Yes.
Yes. So can you hear me?
Yes, yes.
Yeah. So my question is, if there is a heavy metal and gut infection as well, like fungal infection, so what is the our approach towards the first we approach the heavy metal detoxification or the gut infection, like it's a fungal infection first? And what is the
See,
possibilities of getting the fungal infection in the gut?
so ideally, like I mentioned, you have to go parallel. Let's say your microbiome is not healthy, detoxification is also compromised.
Okay.
But if you have heavy metals, you have poor immune system, infection will keep coming back. So parallelly, you have to keep doing both things. But then you have written a question, can I do FMT for fungal infection?
Right.
Now, point being, if you don't remove heavy metals,
Mm-hmm.
immune system will not get better.
Mm-hmm.
So if even you change the microbiome, because immune system is not healthy to keep a control of that or police that, it can
Mm-hmm.
become unhealthy. So
Okay.
first baseline cleanup has to happen, both infections and your toxins.
Mm-hmm.
And then based on the, how the body is performing and all that, if required, FMT can be done once the immune system is great,
Mm-hmm.
better, stable enough, plus heavy
Mm-hmm.
metals out. Then if you want to explore the possibility of FMT, you can.
Okay, so what is the like time duration of the we can like approach towards the heavy metal detoxification and infection like that has to be
So,
treated?
so
What?
Abhishek, you have to understand one thing. How much is the problem?
Mm,
And how well we are able to do it, and how much the body is able to detox. That is a bit like how well the body is detoxing. Some children can do it fast, some take time. So if there is 100 points you have to remove, depending on
mm,
how much a child can remove faster,
mm,
it
mm,
might take 9 months. You can maybe more than that also.
mm.
It's very tough for me to come with the one number because I don't even know how much is the problem and how well child is responding to it, or how many tools I have to put it to remove it. Hmm?
Mm, mm.
But then you keep it 9 months, 1 year.
Okay, it's around that. Okay, thank you.
Yeah.
Okay. Uh, Vishal, you can go next.
Hey, Dr. Ashwani and Dr. Ruchi. So, you see, my question is slightly because different because I have been doing this biomedical treatment since last 8 months, since last 8 years. My son is now 11 year, and then when he was like 2 years, we started this biomed, and we did it very very rigorously with the initial years like 4 5 years, and then we stopped believing on biomed because we started GFCF diet, and then we started so many things. Then someone said that it has a heavy metal. We did 3 4 times hair metal test, blood test, and then we gave a treatment like EBDA and all those things, for the heavy metal. Then I purchased a hyperbaric. Someone said that you need to provide a hyperbaric treatment. We gave a sessions to hyperbaric. Then we started his GFCF. He's still 11 years, but still on GFCF. We tried each and everything on biomed. I mean, each and every. Then someone said the methylation. We did some, like meto boost. Someone said it's a meto related issues. I mean, whenever we, consulted a doctor somewhere in the world, especially in India or other part of India, the world, then there is some term we came new to us, like meto issue, methylation issue, oxalate issue, hyperbaric issue, diet issue, gut issue, and the list started increasing and increasing and increasing, and we, kept on giving treatments to those issues. But now, after spending like 8 years, now I realize that there were so many other kids in our sessions, and they were like absolutely on no biomed. They are not following any GFCF. They don't know what is the meaning of GFCF. They don't know any meaning of Dan Doctor or Dr. Deepak Gupta or XYZ, any doctor. They have not met any doctor. They are saying there is a delay, and okay, we accept those delays, and we are giving the therapies like in normal therapies, And then now I realize that those kids are improving better than the kids who are especially on the biomed, because we keep on doing the things, we keep on disturbing their bodies on the name of stem cell, on the name of hyperbaric, on the name of oxalate, methylation, meto, gut, and blah blah blah. So what is your view, doctor, on that? I mean, I really want to understand whether we did a kind of a mistake, whether the approach was wrong, or what is the right process in case we want to follow the biomed. Is there someone mentioned that okay, these are the standard like a path to follow the biomed?
Yeah. So Vishalji, I can understand, it's been long time and probably it's not as effective as you would have been expecting. I can understand that. Now, and there are 15% of the cases, okay, by the way, Vishal, 15% of the cases will have spontaneous recovery. You do nothing, like you said, they recover. 85% of the kids will progress with the disease. The severity of the problem will increase. Now, if these children would recover by itself, why would I do sitting at night with these sessions? I mean, I can make my living out of anything. Okay. But unfortunately, 80% will progress. Now, biomed is a name, just like Ayurvedic. Somebody's Ayurveda, somebody's functional, somebody's biomed, somebody's this, somebody that. But at the end of the day, you have to see, are we addressing all the problems?
Okay.
Are we looking at all aspects of the problem? Okay. Now, even though I am saying functional, there's another guy functional, there's another guy functional, we have to see who is the guy who can understand, thereby put up a best plan for that problem.
Sorry, I'm interrupting you, doctor, but that is the role of the parent or the doctor?
Doctor said, doctor, you're not a role, but unfortunately, what
So
I
do
know.
we have such doctors in India? I mean, I really want to know if you can suggest me any. I really want to start biomed again, honestly.
No. We are here.
I'm in healthcare since last 25 years.
What do you do, Vishalji? What do you do? I understand. What you have
I
done.
started all the major chain of the hospitals in India, like Fortis, Apollo, and I was advisor for Ayushman Bharat Digital Mission for the
Sure. So,
government.
Yeah,
But
absolutely.
still, I feel so frustrated that I am not able to do the way I wanted to do for my son.
I would suggest, sir, what is done, as he said, what you have done, I will personally go through it, what has been done, and I will try, since it has not worked to the effect it would have been working that we wanted. My job is to find out what was missing in those treatments at that point of time. Okay. Then I'll
where it
try to
went wrong,
summarize.
kind of thing.
Not wrong, maybe not enough. If there are 4 parts to it, maybe 3 parts are done, 1 part is missing, then still it lingered on. See, it's like we keep doing things into isolation. Somebody's doing only stem cells. Stem cells is a support system. Stem cells cannot fix the problem.
Right.
We have to prepare the body for the stem cells to work for us. Let's say body has mercury. I put stem cells, no good.
Right.
Body has autoimmune problems. I put brain stem cells in the brain, no good. Right. So there's a right way of doing right things, sir. And not that we know everything. Okay, but we have sort of worked around a lot of things and a lot of understanding. So from the basics of the lifestyle, which must be adhered, food must be adhered all times, gut function, where infections are a major trouble. For example, a lot of time everything is done, a lot of nutrition is pumped in, but infections are ignored. No work done on infections. That is one of the missing thing which is done most of the time. Infections are ignored. Okay.
So,
You
I would be happy to discuss. I don't want to waste everyone's time, but I would really happy to discuss, my son's case with you personally in detail. And I really want to know where you are based here in India, so that I can come and meet you.
I'm in Bangalore, sir. You send us the reports. First, I need to study so that I can give you pinpoint answers. This would have been missed.
Perfect.
Then
I keep on visiting Bangalore also every month, so it would be really, I would be happy to meet you.
No problem. Absolutely.
Okay, thank you.
All right. Yash, you can go next.
Yeah, just want to ask regarding to the heavy metal toxicity report, right? So based on the report, whatever metal is high, so would you be able to say, okay, the numbers are quite high, chelation is required or a basic will do? So will you be able to assess based on the report?
No. So yes, that's what I mentioned. It has to be done based on how the child is responding to it. I will not straight away put on chelation. But if chelation at later stage is required, I will not shy away. Okay.
Right.
It is also important. Let's say I do basic lifestyle and remineralization. Child is able to eliminate. Why do I need to bring chelation? But I work for 6 months. Heavy metals are not moving. Why will I leave them alone? I have to do something about it. So really, we have to see based on the response of the child's and keep every 3 months we have to test, retest, so that we know how the behaviorally and cognitively skill-wise child is improving and how the markers are changing. Based on that, then
Right.
we decide.
What is the most accurate way to test these? Is it blood or hair or
You have to, just like Dr. Ruhi mentioned, you can do in the blood. That is typically for recent toxicities. But a lot of time, what comes, the load of toxins is so much, body cannot even put into the tissue. It is still floating in the blood. But how much in the tissues, how much in the brain, how much in the bone, there's no absolute test. This is all relative.
Okay.
So you have to, a lot of time what happens as we detoxifying in the blood, before it goes out, it rises in the blood. So a lot of time after 3 months, you start with the X number of lead in the blood. After 3 months, this X have become double X because bones has started putting it into blood before it goes out.
Okay.
So there's no absolute way. There's no absolute way. Somebody will say blood is bad. Somebody say hair test is bad. Somebody say you need chelation, urination thingy. It's all relative. So it depends on the person who's doing it, what are they comfortable with, and ultimately are they able to take care of the problem.
Well, I'm actually waiting for the hair results to come back, and it's been 5-6 weeks already, so I'm just really waiting for that.
So you're waiting for the hair sample report, you said, right?
Yes, it's been with FMD for a while now.
Okay.
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 Thank you.
Neha, you can go next.
Hello?
Yes, Neha, please go ahead.
Okay. Yeah, I have a question. Heavy metal testing was not done on my child. It was just the regular blood work done, but the parameters like potassium, uric acid, and phosphorus was increased. It's slightly higher. So, do they also impact the body? And he's now hyperactive and he has a lot of sensory issues. So, do these elements also impact the body other than the heavy metals?
For example, uric acid can be produced by the infections, fungal infections.
Okay.
When there's high oxidative stress in the body because of various problems, body can increase uric acid as antioxidant.
Okay.
Right? So these problems are reflection of the underlying issue. They are not a problem by itself. They're reflecting some problem. So we have to correlate with the symptoms and the problem of the child and try to make sense out of it and do a treatment for it.
Okay. Okay. Okay.
Dehydration can, if the child is dehydrated, then potassium, sodium can become little up and down on the test.
Mhm. So like last time also, like we conducted some test in the month of January and then in April. So in these 3 months, the tests were like on a higher side. So I don't know, like hydration can be the issue, like you said.
Yeah. So, we have to see into context, Neha.
Okay,
But
sure, sure.
uh,
Okay. Uh, all right. Nikita, you can go next.
हेलो सर।
Yes.
एक्चुअली ना मेरे बेबी को है ना प्लान स्टार्ट किए 1 मंथ हो गया, बट है ना उसको 2 बार फीवर आ गया है। और है ना वो बहुत अच्छे से रिस्पॉन्स कर रहा है, जैसे कि पॉइंटिंग शुरू कर दिया है। बट ये फीवर की वजह से बार बार उसका ट्रीटमेंट मतलब वो प्लान मतलब 4-5 डेज के लिए स्किप हो जा रहा है।
सो निकिता,
सो
अपना, हाँ, बात पहले भी हुआ था, आज भी मेरे डॉक्टर ने बताया कि बुखार आया है। देखो, इम्यून सिस्टम वीक होने की वजह से बुखार आता है ना। और जब
ओके।
फीवर आता है, वायरल फीवर आता है, तो इन्फेक्शन बढ़ जाता है, फिर से फंगल इन्फेक्शन फिर से बढ़ जाता है। तो
ओके।
आप इसको लेके ना तो आप चिंतित रहो, ना थोड़ा वरी करो, है ना। हर चीज को स्टेबलाइज करने में टाइम लगेगा। इट्स
ओके।
नॉट।
बट डॉक्टर उसको ना 2 बार एंटीबायोटिक, मतलब उसका फीवर विदाउट एंटीबायोटिक वो जाता ही नहीं है। तो वही आपने मेरे को बोला था कि एंटीबायोटिक से बहुत नुकसान होता है। सो यही यही वजह है एक्चुअली बहुत
या, नो, आई नो, देयर इज नो सिंपल आंसर्स अंकिता। मैं एंटीबायोटिक चाहिए, मैं बोल दूं नहीं चाहिए, तब भी प्रॉब्लम है। लेकिन अनवांटेड एंटीबायोटिक्स कम्स एट अ कॉस्ट। तो प्लीज, जब तक हम पुश कर सकें, हमको कोशिश करनी चाहिए। लेकिन नहीं चल रहा है एंटीबायोटिक के बिना, तो अंडर द कवर ऑफ प्रोबायोटिक्स कर लेना चाहिए। तो क्योंकि वो लोकल इशू है, इट्स लोकल डॉक्टर हैज टू हैंडल इट। देन अगर करना भी है तो हाई डोज प्रोबायोटिक्स अवे फ्रॉम द एंटीबायोटिक्स टू बी डन along with antibiotics so that damage can be minimized। हम 100% डैमेज को तो रोक नहीं सकते हैं, मिनिमाइज कर सकते हैं। लेकिन मोस्ट ऑफ टाइम जो वायरल फीवर्स होते हैं ना, 7-8 दिन लग जाते हैं उसको,
ओके
स्पेशली
सर।
जब।
हाँ एक्चुअली मेरे छोटा वाला बेबी है ना, उसको भी साथ में आ जा रहा है बुखार। और लास्ट टाइम है ना डॉक्टर ने 5 डेज के लिए एंटीबायोटिक रेकमेंड किया था, सो मैंने 5 डेज के लिए दे दिया था। सो ये टाइम पे भी 5 डेज के लिए रेकमेंड किया है, तो मैं 2 दिन या 3 दिन ऐसे चलेगा क्या?
प्लीज अंडरस्टैंड वन थिंग, रेजिस्टेंस ऑफ एंटीबायोटिक इज अ वेरी बिग प्रॉब्लम। अगर
ओके।
हमने इन्फेक्शन को ठीक से कंप्लीट नहीं, जो जो भी हमने चालू किया, अगर उसको फिर से ठीक से नहीं कंप्लीट किया, बायोफिल्म आ जाएगा। बायोफिल्म इवन बिकम मोर टफर लॉन्ग टर्म में। तो जो भी करना है, अपने डॉक्टर को बोला है उसने, तो करना है तो पूरा कर लो, उसको बीच में मत छोड़ो, अब जो भी उसका कॉन्सिक्वेंसेस है। लेकिन बायोफिल्म
ओके।
है तो फिर बिगर कॉन्सिक्वेंसेस। बट देन पॉइंट इज कि भाई, अगर आपका डॉक्टर एंटीबायोटिक दे रहा है तो पूछ लो ना कि बैक्टीरियल इन्फेक्शन है क्या, कि वायरल है। अगर वायरल है
सर
तो।
वो एक्चुअली यही तो कंसर्न है मेरे को है ना। ब्लड टेस्ट से बिल्कुल डर नहीं लगता कि मेरे बेबी का ब्लड टेस्ट हो जाए, बट डॉक्टर नहीं करते। लास्ट टाइम भी उसको 25 डेज पहले बुखार आया था। सो मैंने ये टाइम डॉक्टर को बोला कि क्यों उसको बार बार बुखार आ रहा है। तो ये आप उसका ना लास्ट टाइम है ना उसका जो
हम्म,
प्राइवेट पार्ट है ना वहाँ पे थोड़ा सा रेडनेस था। तो मेरे को ऐसे लगा उसको यूरिन इन्फेक्शन है। सो डॉक्टर ने मेरे को बोला नहीं, बट मैंने उसका यूरिन रूटीन टेस्ट किया। तो उसके ना तभी ये मतलब पस सेल्स है वो 2 आए थे। और
yeah,
वो एपिथेलियल सेल्स वो भी डिटेक्टेड ओकेजनल ऐसे आए थे। तो ये टाइम फिर से डॉक्टर ने मुझे बोला नहीं कि यूरिन टेस्ट करो, बट उसकी यूरिन पेल येलो कलर की थी। सो मैंने कर लिया, तो अभी उसका रिपोर्ट बता रही हूँ। देखो, रेड रेड ब्लड सेल्स है डिटेक्टेड ओकेजनल। पस सेल्स अभी 5 है, 4 to 5। ओके। और ये एपिथेलियल सेल्स भी डिटेक्टेड ओकेजनल। सो ये 5 अभी मैंने डॉक्टर को रिपोर्ट दिखाया नहीं है। बट ये भी प्रॉब्लम है क्या, इसके वजह से होता है क्या बुखार? क्योंकि मेरे को भी यूरिन इन्फेक्शन हुआ था। तो इसके वजह मेरे को यूरिन इन्फेक्शन का बहुत प्रॉब्लम था, और मेरे को भी बुखार आता था बार बार। तो ये मेरी
अच्छा,
बेबी को भी इसके वजह से हो रहा है।
देखो, ऐसा समझो कि अगर रेड ब्लड सेल आया, पस सेल आया, तो
ओके।
इन्फेक्शन तो है।
हाँ।
अब पॉइंट है कौन सा इन्फेक्शन है। अगर वो है फंगल इन्फेक्शन, आप कर रहे हो एंटीबायोटिक, आपका इन्फेक्शन बढ़ जाएगा।
ओके।
समझ गए ना? एंटीबायोटिक से ईस्ट एंड फंगल बढ़ता है बॉडी
बढ़ता
के
है।
अंदर, वो
ओके
इस्टेब्लिश्ड है फिनोमिना, मैं नहीं बोल रहा हूँ, आपकी बुक्स बोलेंगी किसी भी डॉक्टर को। लेकिन डॉक्टर क्या है कि हर समय कुछ भी हो एंटीबायोटिक, आपको वायरल इन्फेक्शन एंटीबायोटिक, आपको फंगल इन्फेक्शन एंटीबायोटिक, आपको पैरासिटिक इन्फेक्शन तब भी एंटीबायोटिक कर देगा। अरे एंटीबायोटिक से बाहर निकलना चाहिए अपने को यार, जब
सर,
चाहिए
मैं
तो
तो
चाहिए।
यही तो प्रॉब्लम है। मेरा बेबी 2 साल का है, बट उसको हर महीने में एंटीबायोटिक लग रहा है। मतलब 2 महीने में तो देना पड़ ही रहा है। तो मेरे को एंटीबायोटिक से पीछा छुड़ाना है, और मुझे मतलब समझ रहे हो ना आप, ये इसका क्या सोल्यूशन है? ये बुखार का कोई रूट
नैनोसोमा,
कॉज समझते हैं?
अब लोकली ना
नैनोसोमा यूज
उनको,
कर रही हूँ।
लोकल भी जहाँ पे रेडनेस था वहां भी नैनोसोमा डाल दो।
ओके।
हम्म?
ओके, और नैनोसोमा तो चल ही रहा है, बट ये फीवर के
आप
लिए
स्प्रे
कुछ
भी कर
ऐसे।
सकते हो निकिता, वही डॉक्टर अश्विनी ये कह रहे हैं कि जहाँ पे इन्फ्लेमेशन है वहां पे नैनोसोमा स्प्रे भी कर सकते हो। तो ठीक है, वी हैव बिन ट्राइंग, धीरे धीरे चीजें सेटल भी होंगी। ठीक है, आप ये नैनोसोमा लोकली भी स्प्रे करके देखिए, दैट विल ऑल्सो हेल्प। एंड एनीवेज आप ओरली भी दे रहे हो, सो दैट विल ऑल्सो हेल्प इन स्ट्रेंथनिंग द इम्यून सिस्टम।
ओके ओके। सो यही, क्योंकि ना मेरे बेबी ने बहुत अच्छा रिस्पांस किया है, वो पॉइंटिंग शुरू कर दिया है थोड़ा सा। मतलब अभी हम लोग जहाँ पे पहले रुकते थे ना, वहां से भाग जाता था। अभी वहां पे रुक रहा है, और बहुत मतलब समझ रहा है, उसका थोड़ा चेंजेस हो रहा है। वो भी सिर्फ इतना कम कम टाइम पे,
या
1 मंथ भी उसका प्रॉपर ट्रीटमेंट नहीं हुआ है। बट ये बुखार के वजह से ऐसे हो रहा है ना, सो बहुत
आप
मतलब
ना
मेरे
धैर्य
बेबी को।
रखो। नहीं, आई
ओके
नो,
ओके।
आप भी यंग हैं, आप भी छोटी उम्र है आपकी, प्लीज थोड़ा पॉजिटिव रहना है, धैर्य रखना है ना? ठीक है, हम दूर बैठे जो भी बेस्ट कर सकते हैं, लोकल डॉक्टर का जरूरत है तो उसको भी इन अप्रेस रखना है, लेकिन डोंट वरी, विल फाइंड आउट अ सोल्यूशन आंसर।
ओके, सो मेरे डॉक्टर ने ना होम्योपैथी रेकमेंड किया है कि आप उसको, कोई तो है वो
हाँ
रिकरेंट फीवर है उसके लिए, कोई तो हम होम्योपैथिक दिखा दो। तो ऐसे प्रिवेंटेशन के लिए भी यूज होता है होम्योपैथिक,
हाँ।
फीवर प्रिवेंटेशन।
यस।
या होम्योपैथी इम्पोर्टेंट यार, वो अच्छा है, वो नुकसान भी कम है। तो आप कर लो, एक अच्छे होम्योपैथ को दिखा लो लोकली।
ओके ओके, फिर ये फीवर की प्रॉब्लम सेटल हो जाएगी ना सर?
होना ही पड़ेगा, इम्यून सिस्टम अच्छा होगा तो होएगा ही।
ओके ओके सर, ओके, थैंक यू थैंक यू थैंक यू सो मच।
All right. Any questions? So there's a question about oligoscan.
या ओके।
Is oligoscan good for checking heavy metal in the body? So oligoscan is also checking heavy metals in the tissue, just like hair sample analysis is doing.
Yeah, it can be done, can be done. See, please understand, heavy metals is such a thing that there is no best test, there's no absolute test, all are relative, right? People sometimes don't understand the nuances, they say this is good, this is bad, this is best and all that, there's no such thing. So you, for a reference, you do what you have to do, no problem.
All right. So we'll quickly take the other two questions. Are there any parents here? I don't know. Though it's for all new parents. Are there any parents who are already on the treatment? I know Nikita. Was there anyone else?
We just got started this. Results for some of the reports are awaiting, but we have started the local changes. It's just been few days, I would say.
Uh, okay, I could not hear you clearly, Yash, but I think you're waiting for the reports. Okay.
Yeah.
All right. Okay. All right. Shivani, go ahead and ask your question.
Hi, thanks for the opportunity. So, sir, we are planning to start the treatment for my 3-year-old kid. So, how long does it take? Obviously, I understand that it depends on the severity of the case, but again, what is the minimum and maximum time to expect the results?
How old is your child?
He's three years now.
Between 1.5 year to 2 years, we can, lot of turnaround can happen.
Okay, so I'm based out of Noida, and my husband has spoken to you yesterday only. So, is there a possibility, like, is it only online consultation, or we can, if required, we can come in person also?
See, this program is designed such a way that we can do all the best things on an online model. Okay. Now, because my time is so limited. Okay, today from the morning, just I'm in working. Hardly we get time. If we have to see a parent in offline model, we at least need 2 hours. That means I cannot even do my work. That is why we have restricted. But then, this model itself will do the best of the job. I can assure you about it.
Yeah, so as one of the parents mentioned that her child is getting fever again and again. So even if we start the treatment, if something of this sort happens, so side by side we can go for allopathic medicine also to cure that particular disease at that point of time, right?
Yeah, you can certainly, but we'll keep you informed, good and bads of that. अगर एलोपैथी से क्योर होता तो प्रॉब्लम ही नहीं था. मैं भी तो एलोपैथ हूँ. I could have done it.
Right.
You understand, not
So
that against and pro and this and that. For me, what is the right thing at the right point of time? If I cannot do it myself, I will just still my team or me will inform you the good and bads, and then you take a call. What is necessary, we do it. No problem.
So my child has a lot of gut issues. Like he gets gastric like every week, I would say, and it is at such level that he cries a lot. So so today's session you focused on heavy metals. So gut health and heavy metal they will be treated like in one go or one step by step, one thing at a time.
So they go
No,
in
please
parallel.
understand.
Okay.
The heavy metal load is a lot. So we first have to prepare the body for the detox also. So based on what's the severity of the gut infections and everything, we decide phase wise what needs to be done.
Okay, so I believe there must be a team of doctors. So Ashwini sir, do you like assess the case like progress report? Do you do the progress or say after a month analysis of the case? All the cases are
Month is
handled by
no, no. Every case, any treatment plan that goes out from my team is reviewed by me. I'm a part of the planning. Whatever treatment planning happens, I'm a part of it. Every case. Okay, 3 months we retest, reevaluate, make a new plan. Another 3 months, retest, reevaluate, make a new plan. So I am always a part of it. I might not be able to talk to you, but I know what's happening.
So I would also want to just share quickly, because often parents also have a concern that how does this treatment happen online, right? We are not seeing the child. How are we getting to know what's happening? So we take a very detailed questionnaire history, where you have to provide us a lot of information about the child, and this is a lot of symptoms right from head to toe, about the sign and symptoms, about history, what the child eats, everything you provide us. And then we do detailed testing based on all the biomarkers and the sign and symptoms. Then we do an analysis to make a personalized treatment plan for the child. And then you're a part of a personalized WhatsApp group, which is with your assigned doctor. So, who coordinates and is the plans. So, there are 4 consultations. The first consultation happens after you fill the questionnaire so that the doctor can take any additional information or you have to share any additional information. The second consultation happens after the treatment plan is emailed to you. And the third and the fourth are the follow up consultations. Apart from this, you have WhatsApp support. So you can message in the WhatsApp group during the working hours, and the assigned doctor will provide you support over WhatsApp. And then every 2 weeks, you have a live session which Dr. Ashwini takes, and he's available to answer any questions that you may have. So that's every 2 weeks in the evening over the weekends. Apart from this, you have access to resources which are on different topics that is important in your child's recovery. So there are various touch points. So any parent who is committed to really working on their child's health, you will have enough support during the journey of your treatment with us. Okay. So we'll quickly cover the others. Sachin, you can go ahead. Nidhi, I think you already asked your question, so we'll skip you for now. Sachin, please go ahead.
Yeah. Actually, yeah. Thanks, Ruhi ma'am and Ashwini sir. Actually, I'm going to start the take the membership for this program for my son. My son is 5 years old. I give a little bit background. I started early intervention for my son when he was 3.5 years old, and due to OT and due to the speech and some early intervention, some probiotic, almost he recovered 60 percentage. That's I analyze. Huh? So he going to the normal school. Huh? So he's expressing, he's verbal now, very verbal. He explaining what going on in his school. So that's fine. But remaining 40 percentage, I want your help. So my question for you, Ashwini sir, uh, how these heavy metals impact if we go to the check, if we check EEG. Does EEG helps to determine whether the kids have the heavy metals, and how it's impacting the front lobe, and if it's impacting the front lobe activities? I'm not from the medical background. Please correct me. So it's all my research, and maybe it's wrong. So is it the neurofeedback will help in that situation? That's the question.
So EEG is a technique to pick up the abnormal electrical signals in the brain. That's all it does. It does not tell you what is wrong. It is only telling you there are abnormal electrical signals in a very plain, simple language. One of the reasons of these poor electrical signals, of abnormal signals, could be inflammation of the brain. And these toxins causing autoimmune problems, causing localized inflammation, can cause to that EEG abnormal changes. Okay. This neurofeedback, I don't have experience with it, but I think it's a good modality. It can be supportive.
And sir, what's the difference between high IQ? He has high IQ, because I found in his school feedback. I never went and tested that, but as per the school feedback, he has high IQ because he is solving his paper, also his other friends' paper, question paper, and he remembering everything. I'm a little bit worried about that, but he's not sitting at one place sometimes. And uh, I just want to ask you, autism and high IQ, is it the same thing or it's a different thing?
Okay, now, depending on what is the problem, we are giving different names. If a child is high IQ, it's fantastic. What is the problem? It's
Yeah,
absolutely no, it's a good thing.
but some symptoms which has
Understand.
autism.
I'm coming. The child is not able to sit at one place. There must be a reason behind that sitting. One of the reason of child not able to sit is parasitic infection in the body, because of that the child is not stable. Right? So we can solve that part and let the IQ be good and best. Fantastic. So when I say our child can sometimes be able to perform better than normal by reducing some of the problems, that's what exactly I'm saying. They are capable, but there are some hindrances, not exactly maybe pure autism. Some traits of it because of underlying issues. You fix the underlying issues, a lot of these things are out.
Okay, fine. So I will come back to you one-to-one, Dr. Ashwini, for consultation once I started the membership, and I will share all the details of mine. So I would like to go with you how we can cover the rest of the percentage.
Sure.
Thank you, sir. Thank you so much.
Mitu, you can go next.
Hi, thanks for letting me speak. So, my son just turned 5, and he had a speech delay, but and initially when he was around 2.5, when we started noticing some problems, he did have some sensory issues. But then again, we did early intervention. We've been doing speech therapy. We did some OT, and all the sensory issues went away. He's verbal now, not as much as somebody, a kid of his age should be, but he's verbal. He can communicate all his needs. His vocabulary is really good, and he cycles. He plays a lot of sports. But I still see an issue with the speech and then social skills. And another thing that I wanted to add is that since his birth, he has had atopic dermatitis. So I think that again, like from my research, like you said, could be related to gut issues. But otherwise, his immunity is really good. Bowel movements, no stomach issues. He eats very healthy. So, like, given all of these things, do you think it could still be a case of heavy metal toxicity, or is like some other underlying issue?
Now, please understand, we just picking a one topic out of the whole ocean.
Mhm. Yeah.
Could be a problem, it might not be a problem. Until we test it, we don't know.
Right. Okay.
Secondly, atopic dermatitis, one of the reasons could be fungal infection, and fungal infections can contribute to the problem in various ways.
Okay.
Hmm? Now, the
Okay.
point is, some things have settled down, fantastic. Some things are pending. Maybe the
Mm-hmm.
brain is not as functional as it should be functional for his age.
Right. Right.
We can work on that.
Okay. Okay. Sure. All right. Thank you so much.
Garima, please go ahead.
हेलो मैम, हेलो सर, गुड इवनिंग।
अच्छा,
मुझे ये पूछना था सर कि मेरा बेटा अभी 5 साल का है। उसका मतलब 2 ईयर से उसका मेडिसिन चल रहा है। तो ये लॉन्ग टर्म में मतलब क्या हार्म हो सकता है उसको? मतलब माइल्ड ऑटिज्म का डायग्नोसिस था, मतलब
क्या
3.5 करवाया।
मेडिसिन
जी,
क्या चल रहा है?
उसका रेस्पेरिडोन चल रहा है सर।
देखो, आपको ये समझना
हाँ
है कि
जी।
रेस्पेरिडोन इन अ वे इट एक्ट लाइक अ सप्रेसेंट।
हाँ।
उनको हाइपर एक्टिविटी किसी वजह से है।
हम्म।
वजह तो हमने देखी नहीं लेकिन हमने उनको सप्रेसेंट करके तो टेम्पररी उनको स्टेबल कर लिया, विच इज फाइन, नथिंग रॉन्ग।
हम्म।
लेकिन अगर हम किसी प्रॉब्लम को हटाते नहीं है बॉडी से, उम्र के हिसाब से वो प्रॉब्लम बढ़ भी सकता है। तो कई बार क्या होता
हाँ।
है कि उसको 0.5 ml की रेस्पेरिडोन से चालू किया, सब स्टेबल है, अच्छा है। अब
हम्म।
2 साल उम्र बढ़ गई, प्रॉब्लम बढ़ गई, 1 ml भी काम नहीं कर रहा है।
हाँ।
हम्म? तो वन तो जो ड्रग का साइड इफेक्ट है उसको तो चलो जो भी है वो एक प्रॉब्लम है, और चलो ठीक है, एटलीस्ट वो हेल्प तो कर रहा है, लेकिन वो साइड
हाँ।
इफेक्ट है, एक चीज हो गया। लेकिन अंडरलाइन प्रॉब्लम जो सॉल्व नहीं हुई है, इफ उसको हम सॉल्व नहीं करते हैं तो बढ़ भी सकता है वो।
हाँ। हाँ।
तो फिर बाद में कॉन्सिक्वेंसेस टफ हो जाएंगे, मुश्किल हो जाएगा
अभी
प्रॉब्लम।
तो अभी तो काफी सेटल है सर, थोड़ी स्पीच भी अच्छी हो गई है उसकी। तो
हाँ,
अब क्या बंद कर सकते हैं?
नहीं नहीं, प्लीज
जी।
अंडरस्टैंड। अब बुखार
जी।
है,
हम्म।
बुखार के लिए पैरासिटामोल खा लिया।
हाँ।
अगर बुखार नहीं आ रहा है तो पैरासिटामोल का क्या काम है?
हाँ।
लेकिन अगर बुखार पैरासिटामोल के चलते ही रुका हुआ है,
हाँ।
इन्फेक्शन को हमने हटाया ही नहीं, तो पैरासिटामोल लेते रहना पड़ेगा।
हम्म।
अगर
ठीक
आपका
है सर।
रेस्पेरिडोन से ही काम चल रहा है तो उसको भाई और कुछ नहीं करेंगे तो वही लेना पड़ेगा। लेकिन उसको हटा के अगर देखते हैं बच्चा स्टेबल रहता
हाँ।
है तो क्यों जरूरत है अपने को?
ठीक है।
है ना? तो जिन्होंने
तो
दिया है उनसे बात कर लो एक बार, और एक बार वीनिंग ऑफ
हम्म,
करके देख लो। अगर वो सेटल रहता है, बच्चा ठीक रहता है, तो फैंटास्टिक, अच्छी बात हो गई फिर तो।
क्योंकि सर जितने जितने पेरेंट्स से भी, जितनों से भी बात होती है, सभी कहते हैं कि नहीं, मेडिसिन नहीं देना चाहिए, बहुत साइड इफेक्ट होता है। तो वही आपसे थोड़ा सा पूछना था कि सर उसको 2 ईयर से चल रही है, तो कोई ऐसी प्रॉब्लम आगे चल के।
बात आपको सही है। ये
जी।
कोई भी इमरजेंसी ड्रग है, उसको लाइफ लॉन्ग तो नहीं यूज कर सकते हम लोग, वो तो है ही ना लाइफ में।
हाँ।
वैसा।
ठीक है। जी। मतलब अब धीरे धीरे करके उसको उनके डॉक्टर से कंसल्ट करके और कम करने के उसमें। जी।
अगर बच्चा स्टेबल है तो कर लो, क्यों नहीं करना
हाँ।
है?
हाँ, अभी तो स्पीच भी ठीक है उसकी, बढ़िया हो गई है।
या
ठीक है सर, थैंक यू। थैंक यू सो मच।
ठीक है जी।
Okay. All right. Uh, Chandrasekhar, you have a question? You just messaged. We'll quickly take your question if you have.
Hello, ma'am. Hello, sir.
Yes, Chandrasekhar. Yes.
Am I audible?
Yes, yes.
Yes. Thanks for allowing me to speak. मेरा क्वेश्चन ये है मैम कि इधर मैंने देखा था, आपने लिखा था कि वैक्सीनेशन की वजह से ये होता है।
हाँ, हमने कहा
तो
कि
फिर अगर वैक्सीन
वैक्सीन एक ट्रिगर हो सकता है बाबू, ऐसा नहीं कहा कि वही एक वजह है, उस एक ट्रिगर हो सकता है। हाँ, आप बताइए।
नहीं, तो अगर जैसे कि अगर पेरेंट्स ठीक है, मम्मी भी ठीक है, हस्बैंड भी ठीक है, कभी इन लोगों को बचपन में ऑटिज्म नहीं हुआ, तो अगर जो अब नए बच्चे हैं, मतलब मैं तो ऑब्जर्व कर रहा हूँ, मतलब बच्चे को मैं स्कूल में लेके जाता हूँ तो काफी बच्चों को ये स्पीच डिले का इश्यू है। तो ये कहाँ से आ रहा है इनके अंदर, हैवी मेटल्स कहाँ से जा रहे हैं इनके अंदर?
वही तो मैं
मतलब ऐसा तो, मतलब ये तो सोचने की बात है ना कि अगर वैक्सीन।
देखो, ऐसा है चंद्रशेखर साहब, कि इट्स अ वेरी टची सब्जेक्ट। ओके, इट कैन लीगली पुट अस इनटू ट्रबल, तो प्लीज रीड
आप
इन बिटवीन
समझदार हो, आप समझ गए होगे. So I think it's better, it's well understood.
ओके।
All right. Okay, we will wrap up today's session, and thank you all.
Doctor,
Sir,
sorry.
the question, sorry.
Hello.
Yes.
Hello, doctor.
जी
हाँ.
निकिता बताइए.
यस डॉक्टर, एक्चुअली ना लास्ट टाइम उसको यूरिन मतलब 2 पस सेल्स आए थे ना, 2 to 3. सो वो डॉक्टर ने ना सेफोडॉक्सिम रेकमेंड किया था. ओके. तो फिर ये टाइम भी आए हैं, तो मतलब ये टाइम यूरिन का रिपोर्ट उनको दिखाया नहीं है, पर वही सेफोडॉक्सिम में चालू है. बट आई थिंक है ना, यूरिन मतलब पस सेल्स आए हैं तो नाइट्रोफ्लोरेंटन या ऑफ्लॉक्सिन, नॉरफ्लॉक्सिन, ये सब यूरिन में चलते हैं. सो ये ट्रीट करने की जरूरत है या चलेगा? अगर 5% से तो कोई प्रॉब्लम नहीं है.
पहले डिफाइन करना निकिता, कि बैक्टीरियल इन्फेक्शन है कि फंगल इन्फेक्शन है। पस सेल तो फंगल इन्फेक्शन से भी आ सकते हैं, तो आपने कैसे
ओके.
डिसाइड किया वही ड्रग चलेगा?
मैंने नहीं
भाई
डिसाइड
पहले
किया, वो
नॉर्मल,
डॉक्टर. सो ये किस
प्लीज भाई
टेस्ट
तुम,
से क्लियर होगा कि बैक्टीरियल है या फंगल है?
ठीक है, सेपरेटली बात करने की, तो प्लीज अंडरस्टैंड यार, कुछ चीजें हम सामने से बोल दे रहे हैं, कोई डायरेक्टली बोल दे रहे हैं, कोई इनडायरेक्टली बोल दे रहे हैं। प्लीज समझने की कोशिश करा करो यार, कि हर चीज को हम रिस्पॉन्सिबिलिटी लेके नहीं कर सकते हैं। जो चीज हम बता पा रहे हैं, जिसके दूर बैठे हम कर सकते हैं, हम कर रहे हैं। लेकिन कोई भी इन्फेक्शन को ट्रीट करने से पहले देखना चाहिए कौन सा इन्फेक्शन है वो अगर बैक्टीरियल है तो कौन सा बैक्टीरिया है, उसके लिए कौन सा एंटीबायोटिक काम करेगा। अगर कोई और तरह का इन्फेक्शन, उसको देखना तो चाहिए ना हर चीज में, क्योंकि वो यूरिन के इन्फेक्शन में वो एक एंटीबायोटिक चालू होता है, तो वही चालू तो करते रहेंगे क्या? वो तो काम नहीं कर रहा है, वो रेजिस्टेंस बन गई है उसकी।
ओके.
तो आपको
ओके.
जो कहा है वो कर लो, ज्यादा चिंता नहीं करो। होम्योपैथ
ओके.
को दिखाना
Sir,
है।
ठीक है, we will wrap up now.
the question, ma'am, sorry.
Neha,
Can
I
you ask
think
the
you can connect with the team. We will really have to wrap up now. Meera and Anwar, they will be available to address any further questions. Um, okay. So thank you all of you for joining with us today. And I hope today's session was useful. And thank you, Dr. Meera and Anwar, for putting this together. It's been a lot of effort to send out reminders to parents and have them attend the session. Thank you. And
Thank you, sir. Thank you, everyone. Yeah, thank you, ma'am.
yes, those who
Thank you,
have
ma'am,
further
for
questions, please connect with both of them and they will help you address any further questions that you may have. And if you've not joined our WhatsApp community, we have made a community which is beyond the autism diagnosis. So do join that, where we keep you informed about our upcoming workshops. You will also get to know about some informative blogs. So we are trying our effort best to share and create more awareness in whatever way we can. So I hope you all can benefit from that. And with that, we will wrap up. Thank you so much and namaste.